Welcome back. Medical debt can be crippling, especially for low-income patients. A new CBS News investigation reveals nonprofit hospitals are collecting tens of millions of dollars in debt, despite getting more than $37 billion in tax breaks nationwide.
Tonight, WJZ investigator Mike Helgren shows you some of the strong patient protections in Maryland and who is eligible for free or discounted medical care.
When you have a medical emergency, you head to the hospital. And when your life is on the line, the last thing you're thinking is, how will I pay the bill? A CBS News investigation shows the more than 50 nonprofit hospitals in Maryland are getting $700 million annually in tax breaks in exchange for providing free or discounted care to low-income patients. Yet some still try to collect from those same patients for medical debts.
It was really difficult to suddenly have bill collectors trying to contact us when my husband's out of work, is relearning how to read and write and talk again.
Michelle Gregory knows how devastating medical debt can be. Almost 20 years ago, her husband had a stroke, and even though they had insurance, the medical bills piled up.
I don't want anybody to go through what we went through. It was so stressful. It was terrifying. I thought we were going to lose our housing. I thought we were going to lose everything.
I just want to read something that I wrote earlier.
Gregory became a fierce patient advocate and ran for the Salisbury City Council, where she holds a seat today.
Does it feel like a David and Goliath battle with these big healthcare systems?
Very much so, but like Han Solo, never tell me the odds. I don't back down from a fight very easily.
In the almost 20 years since her ordeal, Maryland has put patient protections in place for medical debt. No liens on homes, no wage garnishment, and payment plans cannot exceed 5% of income for low-income patients. Much of it because of the work of lawmakers like Delegate Lorig Charkoudian.
The fact that something that should be available to everybody as a fundamental right is actually making people financially destitute means we have to take some action. We're not suggesting that no one should pay their hospital bills, right? We're talking about people who are struggling to pay their bills getting the financial assistance. We're talking about people who are struggling to pay their bills getting payment plans.
It's ways to strengthen and add and tighten up the financial assistance.
Charkoudian says there's still more to do and sponsored a bill that passed both chambers of the General Assembly this year.
House Bill 268, having received a constitutional majority, is declared passed.
It creates minimum standards for discounted care, gives patients more time, 240 days after the receipt of the initial bill, to apply for financial assistance, and prohibits lawsuits for less than $500 in medical debt.
The cost is massive to come and defend against a $500 debt that you already can't pay.
Her bill also sets new standards for how hospitals notify people they're eligible for free or reduced care.
If you think about it, you go now and you sign to say, I understand that if my insurance doesn't pay, I'm on the hook, right? And we think you should also be saying, I understand what the hospital will pay and how I can access that. And so it adds one more layer of making sure that patients understand the financial assistance that is available.
Many hospitals have stopped suing low-income patients altogether, including Johns Hopkins. Recent tax filings show they collected nothing from patients eligible for financial assistance.
Is one of the problems that there is no standard from hospital to hospital about how these programs are presented?
That has been a really significant problem. What we found is some hospitals offer a lot of reduced costs, like a much lower price, and others offer a much higher price. And so actually, depending on where you show up in the state, you may be paying a lot more or a lot less for the care that you receive.
In Maryland, nonprofits are required to provide free medical care for those earning 200% of the poverty level, or roughly $31,000 a year, and reduced cost care up to 500% of the poverty level, or about $78,000 annually. People who believe they're not getting the free or discounted care they're entitled to receive can reach out to the Attorney General's office, which helps mediate disputes.
We get a lot of complaints from consumers who have applied for hospital financial assistance and then never heard back, or have applied and have been denied and they don't think it's appropriate.
It can be complex for patients to navigate and know exactly what they qualify for.
We recently assisted a consumer who was unfortunately diagnosed with cancer and was facing a bill of over $100,000. and he was a fairly low income individual. And so he's got this huge bill facing him. He's in the middle of cancer treatment, and he's just at his wit's end.
There are also nonprofits that can help.
And if you are within a certain income range, the hospitals are actually legally required to write off or reduce the bills that you have. A lot of people just don't know this, and hospitals do a terrible job of telling people about it. So we have millions and millions of people that go on payment plans or declare bankruptcy for bills that they don't have to pay.
Jared Walker founded $4. You just input your information about your medical debt, and his organization will fight to get it reduced free of charge.
I started this organization after watching my own family go through it. I think that a medical crisis should not mean a financial crisis.
So this is something, very close to your heart.
We have had hundreds of patients tell us about how, they weren't able to pay rent. They weren't able to put food on the table. They had to drop out of school. They weren't able to make their car payment. Like, all of the downstream impacts of this is devastating. It makes sense that it's the #1 cause of bankruptcy in America.
Because when a medical emergency strikes, the last thing you should have to worry about is how to pay the bill. Mike Helgren, WJZ Investigates.
All right, thank you, Mike.